my name is Ashley. I'll be your nurse today. Can I get your name and date of birth?
April Crum, 5/29/1998.
Okay, thank you. Do you know where you are?
Lincoln University.
And do you know today's date?
4/25/2019.
Okay, thank you. So you're alert and arena times 3. Today we're going to be doing a head-to-toe assessment. Do you have any questions?
No.
No? Okay. Can I get your height and weight?
I'm 5'3", and I weigh 125 pounds.
Okay. And I would also get to your vital signs. I'm going to do blood pressure first. Can I have you take your arm out of your sweater?
I'm pretty sure I'm sweaty, so.
Alright, your blood pressure is 119/60. Alright. Temperature is 36.4 degrees Celsius. And then I will get, are you in any pain right now?
No.
No? Okay. So on a scale of 1 to 10, it would be?
A 0.
Alright. I'm going to get your pulse real quick. Alright, your pulse is 78 and your respiration rate is 816. So I got your vital signs, and then I'll assess your skin. Can I see your hand? I am going to look for any lesions, lumps, bumps, or bruises. I'm going to check the skin turgor and capillary refill, which they're both prompt. She's warm, dry skin, soft. She's pink all over. I'd also check the other hand. I would check the nails and for any clubbing or any abnormalities. So she's pink, soft, dry, warm, no lesions, cap refills, prompt, Turgor's prompt. And then I will go to the head and face, and I would assess her hair and her scalp. And do you mind if I do this?
Sure.
Okay. So I would just be looking, see if there's any dry spots or any hair loss or anything. Have you been experiencing any hair loss?
No.
No? Okay. And then I would also feel the temporal arteries. And they're +2 and even. And then can I also have you open your jaw, move it side to side, and front back. Alright, thank you. And then, do you have any pressure in your frontal sinuses? Any pressure right there?
No.
Any pressure like along the nose or in front, under the eyes?
No.
No? Okay. Gotta think about this one. I think that's it. I don't know for sure, but we're gonna go on. Oh, no, it's not it. Can I have you smile? Alright, can I have you close your eyes? Don't let me open them. Okay, thank you. Now I'm gonna go to the eyes. Do you have a history of any vision loss? Do you wear glasses or contacts?
I wear contacts.
Are they in right now?
Yes.
Okay. Can I have you hold this for me for just a moment? Can I have you bring it up a little bit? Alright. Can I have you read the last line here for me?
426-739.
And she got it all. And then I will test her gaze. Follow my finger, which you're doing. Good job. And then focus on my finger. Her pupils accommodate. And then can I have you just look at me? Yeah. Her pupils are equal, round, reactive to light, and they are accommodated. And then focus on me, but tell me how many fingers are moving. If you can't, no, don't look at the fingers. If you can't see, just let me know.
1, 2, 3, 3, 2.
Don't look at the fingers, look at me.
3, 2, 3.
Yes. Okay. So I have done her eye acuity, which was the Snellen chart, the gazes, the confrontation, perla accommodation. Her conjunctiva does not seem to be inflamed. There's no pink, there's no drainage. And the external structures there's no lesions or anything. She seems fine. Eyebrows are fine. And then I'm going to move to the ears. First, I'm going to do the Ryan and Weber. I'm going to hit this, and you're going to tell me whether you can hear this equally on both sides or not.
Okay.
It might be a little loud. Do you hear it equally?
Yeah.
Okay. Alright, and then I'm going to hit this again, and I'm going to place it behind your ear. Let me know if you hear it, and then let me know when you stop hearing it.
Okay. Stop. I hear it.
And then, can I have you sit at the edge of the bed for me?
Sure.
I'm going to do a whisper test.
Okay.
And can I have you put, I would also do the tuning fork on the other side to test the other ear. Can I have you put your left finger in your left ear and move it slightly? Alright.
A70.
Okay, thank you. And I would do the same thing to the other ear to test it, which I'm just going to skip it for time purposes. And she passed both the Ryan and Weber and the whisper test. I would then look inside the ear. You can go back to where you were now. Alright, and we don't have any more of the things, so just gonna look. Alright, and her eardrum and canal are free of any impacted earwax. Her eardrum is a pearly white, and the external structures, there's no lumps, bumps, bruises, or lesions. Do you have any tenderness in your ears?
Nope.
Nope. Okay. So her ears are good. Her external structures of their nose are fine. Can I have you plug one side and breathe in and out, and then the other side? Alright, so her nose is patent, and then I'm going to assess her mouth. Okay, her lips aren't cracked or anything. They seem to be moist, I guess is the word. Can I have you open your mouth for me? Wider. Stick your tongue out. Her cheeks are good, and then one more time so I can look in your tonsils. Stick it all the way out. She doesn't have tonsils, is that correct? Do you have tonsils?
Tonsils.
Stick it all the way out and say ah. Okay. She has them. I just couldn't see them at that time. Her hard palate and soft palate are free of any. I didn't use this, so I'm just gonna put that back. Free of any lumps, bumps, bruises. Her whole mouth is moist. Her teeth and gums. There's no bleeding or anything. No irritation. Tongue, lips, teeth, gums, cheeks, tonsils, and hard and soft palate. And then I'm going to move down to the neck. I'm going to start off with range of motion. Can I have you bring your chin to your chest and up and then back? And then chin to shoulder on each side. And then ear to shoulders. Okay, so our range of motion is intact. And then, can I have you sit at the end of the bed, and then I will sit in front of you to make it easier. So her trachea appears to be midline. There's no pulsations or anything. I would feel the carotid, one at a time. +2 and even. There's no lumps, bumps, bruises, or lesions. Do you have any tenderness or anything?
Mm-mm.
Okay, so I'm going to come around and I'm going to check the thyroid. And can I have you swallow for me? Alright, doesn't seem to be enlarged at all. Let's see, what else is there on the neck? Range of motion, symmetry, trach, thyroid, and lymph nodes. I'm just going to go ahead and try and feel all of them from the head down to the neck. Let me know if there's any tenderness. Alright, was there any tenderness? No. No? Okay. So, that's the neck, and then I'm going to move down to the back. I'm going to assess her lungs from back there. Typically, we would have them in a gown, and I'd be able to actually see the skin. I would look for any lumps, bumps, bruises, any lesions. Do you have any tenderness on your back?
No.
No? Okay. I'm also going to look for the spinal processes down, and then I would do tactile firmitus. Can I say 99?
99. 99. 99. 99.
Okay. Can I have you take a deep breath in for me? And out. Alright. Symmetrical. Skin, she's pink. tactile firmitus, also percuss in the 7 spots on each side of the back. Alright, and then I'm also going to listen for a breath on each spot on the back. Can I have you take a breath in for me? Alright, and her breath sounds are clear, there's no wheezing or anything. And then I'm going to come to the front, and I took her respiration rate earlier. They were regular, moderate, and depth, and she seems to be unlabored. I will assess the shape of her chest. It's not barreled, it's not funneled, it's not pigeoned, so it seems to be normal. I would also assess the skin also, and I would listen to the breath sounds under the clothes because there would be a gown. I will try to think on the front. She is pink. Her color, just generally there's no paleness, no blueness, cyanosis. Okay, and then I'm going to percuss in the 6 spots on the front. Okay, and then I will check the sides. Alright, and I'll listen to the 6 spots, same places I would percuss. Alright. Sounds good. Clear, no wheezing, and doesn't seem like there's any fluid inside the lungs or anything. So now I'm going to move down to the upper extremities. Or no, I'm going to go ahead and do the heart first, since I'm already at the chest. And I will first feel the chest for any heaves, lifts, or thrills. I'd also feel at the point of maximum impulse, and can I have you lean forward for me? And I would feel for the apical pulse. And then I'm going to listen to the five spots on the chest. The aortic, pulmonic, tricuspid, mitral, apex, and can I have you lean forward for me? Alright. There's no murmurs or anything, no AFib or heart sounds are regular. +2, and then I'm going to move to the upper extremities. Alright, so can I have you can stand up for this if you'd like, but you don't have to. Can I have you bring your arms up, arms back? Alright, and then bring them away and towards you. Go ahead and cross them in. That's abduct and adduct, flexion and extension, and then can I have you try and touch your fingers on both sides, internal and external rotation. Would also test that. And then can I have you flex your elbows out? Extend them out, flex them towards you, and then supination, pronation. And then while you're doing that, I'm also going to test your strength. Pull towards you, push, pull, push. They're even on both sides, strong. And then we're going to flex the wrists, extend the wrists, abduct them, adduct them. Do your wrists, not your elbows. So just move your wrists, abduct, adduct. And then I'm going to have you push, and then pull. Alright, strength is even on both sides. And then I'm going to have you flex your fingers and your thumbs, bring your thumbs across, extend them, abduct them, adduct them, stick your thumbs out. Alright, and then can I have you go ahead and have them like this, push out for me. Okay, and then can I have you grip. They're both strong and equal. So now I'm going to move to the abdomen. Can I have you lay down for me, please? You mind if I put the head back?
Sure.
Okay. You can just be nice and comfy for this part. Okay. Can we lift your shirt?
No.
No? Okay. So, on a typical patient, I wouldn't ask. We would just assess the stomach. We will look for the shape of it. It is flat. Check the umbilicus, see if there's a hernia or anything. Check the skin for any lumps, bumps, lesions, or bruises. Let's see. I would also look for any pulsations in the stomach, see if I can see a heartbeat or anything. Which from here I don't. So then I would listen. And I'll listen to all 4 quadrants for at least 15 seconds. Alright, her bowel sounds seem normal. They're not hyperactive or anything. They're not hypoactive. Then I would percuss. Was there any tenderness when I did that?
No.
No? Okay. Sounds good. Nice and hollow. Doesn't seem to be any masses. Now I am going to palpate. Let me know if there's any tenderness. I will start off first light. And her abdomen is soft, not distended or firm or anything. Okay, and then I'll go deeper.
Okay.
Still let me know if there's any tenderness. No tenderness. Is that correct?
Yep.
Alright. And I don't feel any masses or anything. Back up. Okay. And then I am going to do your lower extremities. Can I have you... Do you mind standing up or do you want to wait till the end? Okay. Go ahead. So while I have you standing, we're going to do the hip range of motion. Can I have you flex it up, extend it back, abducted out, and then adducted, and then external rotation, and then internal rotation. And can I have you do the same thing for the other leg? If you need any direction, just let me know. External, internal, and then abduct, adduct. When you adduct, make sure you cross the midline. And then can I have you flex your knees, extend them, go ahead and do the other leg. Okay, and now you can sit if you'd like. Alright, so let's do the abduct and adduct of the knee. Can I have you put your knee out? Go ahead, do both knees, and then in. Adduct is in, abduct is out, and then can I have you internally rotate your ankles and externally rotate your ankles, toes to the ground, toes to your nose. Alright, and then I will also check the strength. Alright, go ahead and push, push, even on both sides, pull, even on both sides, in, out, and even. Can I have you put both your feet on my knees so I can test your ankles? Can you push for me? Pull to your nose. Alright, go ahead. I would also assess the skin for any lumps, bumps, bruises. I would assess the color. Nice pink. Hair distribution that's even on both sides. Symmetrical. There's no swelling. Have you noticed any swelling? The color. I would also do the cap refill on the toes. I would have her take her shoes off and socks off. Check the cap refill on her toes. And assess the color and everything on her feet also. So I would do color, edema, temperature, cap refill, range of motion, strength, and pulses. I will feel for the popliteal pulse, +2 and even, the posterior tibialis, +2 and even, and then I would also have her take her shoes off for the dorsalis pedis, which I would feel at the top of the foot, and as long as it was good, it'd be +2 and even. That's everything for lower. And then I am going to do the musculoskeletal, which here I'm going to go ahead and do the deep tendon reflexes. Oh, I'm going to get my hammer. And I will have you just relax. And then her arms would jump up if I was good at this, but I'm not. So go ahead and relax your leg for me. Got reflex on that one. Reflex on that one. And then can I have you hammer your foot? Alright. Normally I would do this without shoes on. Go ahead and just relax for me. And I would hit there. And then relax for me. Hit there. And then I would also kind of see both your feet. Do Babinski's. And if she didn't have her shoes on, she should retract. If she were to fan her toes, it'd be a positive, and that'd be a sign of something is wrong. So we've done the deep tendon. Can I have you move your fingers to your thumb quickly? Okay. And then can I have you touch my finger, then your nose, touch my finger, and then your nose, and just keep going until I tell you to stop. Okay, you're good. And then, can I have you stand up for me again? can I have you just, I'll move this out of the way. Go ahead and walk that way for me. Her gait is steady. And then can you walk back? Okay, and then can I have you do it again, but do heel to toe fashion. Still very steady. And then back. Okay, and then can I have you cross your arms, close your eyes, and just stand there. And you would just assess her balance close so you can make sure and catch her. If she doesn't have good balance, go ahead and open your eyes. Her balance is good, and then can I have you, we're going to do range of motion for the spine. Can I have you reach your hand to the sky on this side, hand to the sky on this side, and then bend all the way down, and I'm going to check for scoliosis while I'm having her do this. Can I have you come up slowly? There's no curvature. I would also assess from here, see if there's any kyphosis or lordosis, which there's not. And then can I have you extend back for me? Go as far as you can. Okay, thank you. And then can I have you rotate? Alright, so we've done the spine range of motion, we've done spine process, and we've done scoliosis test, we've done fingers to thumbs, we've done finger to nose, gait steady, stance steady, and I think we're done. Alright, thank you.